welcome everyone. I see we have folks joining on. We're so excited for you to join us to learn more about behavioral health issues during COVID-19. So as you join, you're going to see that we have a great team of very, very smart, wonderful people that are on the line. And Lauren, I'm so excited to see you again and to see your beautiful face. I think the last time we saw each other, we were out in a park, as I recall. I got a chance to hear you. And I see that proud Papa has joined us also. So thank you to the youth attendees. And really, this is about making sure that you all have the great information that you need to continue to be ambassadors in the community to get behavioral health resources out to you and to your peers. And we know this information is really, really critical. We know this has been a really stressful time and that a lot of folks are feeling that stress. But there are a lot of reasons to be hopeful. And one of them is that we have these wonderful, wonderful leaders here ready to give you information that you can share with the community. And one thing I'll just say is I think most of us at some point in our life have relied on counseling or support and of some kind. And so this is really about also creating an opportunity to get out in the world and let folks know that, as careful as we are about setting an arm, we have to be that careful about making sure that our mental health is healthy and wonderful. So before I introduce the presenters for today's training, I'd like to welcome a very, very special guest, and that is Lauren Mineta. And Lauren is a Behavioral Health Contractors Association intern and really an amazing young woman, even if she weren't being an intern. So Lauren, I'm going to let you get us started.
Thank you, Supervisor. Thank you, Supervisor Cindy Chavez. I'm Lauren Mineta, and I'm an intern at the Behavioral Health Contractors Association. And I'm here to talk about a little bit of my experiences and as well as the COVID-19 pandemic and how that directly affected me as well. So in 2018, I attempted suicide, and it was just from feeling alone, isolated, feeling like I didn't really have anybody. And unfortunately, the COVID-19 pandemic definitely brought up those feelings again, just having to be stuck in the house, feeling hopeless of what the future held and what exactly that meant for my friends and family, feeling as though I didn't really have any strong connections anymore, and just a loss of a school year as well. And I know that for me, what helped a lot and what has helped recently is having a strong social network. With restrictions lifting back up again, finding ways to be able to spend time with peers, with my family again. All of us are vaccinated, so that is something that we were all looking forward to, spending time together again. And it just making those connections again, being out in the community definitely helped me with my own mental health and struggles of not really feeling isolated anymore and feeling as though I was able to meet new people, connect with old friends. And especially what helped me was going to therapy, talking to my therapist about my struggles, about feeling alone, realizing that a lot of other people were in the same situations, and also just having what my family calls Team Lauren. So including family members, being able to talk to them about what's going on, a strong social network with my therapist. And I think that everyone else should be able to have a team surrounding them, like no matter how big or small, just to help them through, not only in the pandemic, but just overall in general. Everyone being able to have their support network and people rooting for them definitely would help. So that's just a little bit about myself for right now. And I think that there was going to be a poll question as well.
Yeah, a Minty Poll.
Mm-hmm. So if everyone just wants to click on the link at the top and use the code.
Yeah, and if you, I'm going to ask Alex, I think we type in menti.com and use the code 89231646.
That's exactly right. Yeah. So if you all would like to use your phones or your your web browser, your tablets, whatever you like to use, you just navigate to menti.com, and then they'll ask you for a code, and you just type in 89231646, no spaces necessary, and then you'll be able to see this and input your response.
And the question we're asking is, the activity you're most looking forward to doing as vaccinations increase and things become safer. So hanging out with friends and school activities like sports and clubs, and our concerts, professional sporting events, more Zoom meetings. Whoever signs up for that one, we're going to have a conversation with you. So let's see if we can get some responses on that Minty poll. Okay, now this is what I was expecting. The friends getting I don't know, Lauren, what do you think? Hanging out with friends, school activities, concerts, professional.
Yeah, no, definitely the friends part. Luckily, a lot of my friends are vaccinated now because we work in the food industry. So that part is probably, I would agree with, friends is the most exciting for me as well.
That's fabulous. So, so Alex, can you tell me where we are with our participants?
Yes, we have 21 people who've responded to the poll questions so far out of a possible 43.
All right, well, let's see if we can get a few more folks to fill out their and I'm going to just assume that those of us who are older are not weighing in on this one. Just an assumption. All right. So I'm not seeing any more movement on this. So I'm going to assume that, oh, concerts have popped up. All right. Well, let me just thank all of you very much for participating in these polls. We think these are good ways just to check in with you throughout our meeting. We're so excited that you're here. And Lauren, I just want to say a very sincere thank you for your openness, because I think what we all need to just appreciate about the time that we're in is that it's challenging, and that, the more open we can be, the more we can help each other. And, I too am on Team Lauren. So
thank you for the opportunity to speak and just bring a youth voice into the conference as well. So thank you.
That's exactly right. And Lauren, I think you are our big reminder that we want to make sure we keep our youth voice centered with our work. So thank you again. And we're joined today by Lauren's father, actually, David Mineta, the CEO of Momentum for Mental Health, and Rachel Talamantes from the Division Director of Children, Youth, and Family System of Care for Santa Clara County's Behavioral Health Services, and our own Dr. Marianne Dewan, our County Superintendent of Schools. I just want to say a very sincere thank you. David has really been keeping us focused on this issue throughout the pandemic, and Dr. Dewan and Rachel for spending your Saturday with us. And David, I'm going to let you all take it away.
Thank you very much, Supervisor Chavez. Again, thank you. Big snaps for Supervisor Chavez and her staff. I want to thank Paul Murphy, Alex Lynn, Victor Perez, just all the staff for so many Saturdays and all the work they do 7 days a week to make us all healthier. So it's an honor to be on this panel with Dr. Dewan and Rachel from the Behavioral Health Services Department. So I just want to again thank Supervisor Chavez for asking Lauren. I did not ask Lauren. Supervisor Chavez asked Lauren to be on to present today, and but I'm very proud of Lauren working in behavioral health, trying to get her story out, and just to try to be helpful in the community for so many folks who have behavioral health concerns and issues. So with that, Alex, I guess we could start the deck. And
Hey, would you like to begin with the Minty Poll or the slide deck?
I guess we could start off with the, I'm sorry. If we could start off with the Minty Poll. So we'll do a second Minty Poll, everybody. And this Minty Poll one is just to see how you're feeling today. Beautiful day. Here we are. We are fortunate to be here on this call and to be here among these wonderful youth COVID ambassadors. So just want to check to see how you're feeling today. So again, if you can type in, or you go to www.minty.com, use the code 56822966. Again, minty.com, 56822966. And just type in how you're feeling today. Yeah, how are you doing today on this wonderful May 1st Saturday? Thanks for good to see people positive, ecstatic, excited, happy. Awesome. All right. Again, all feelings welcome, valid. Excellent. All right. Well, good way to start off our session today. And for those feeling a little tired, thank you. If I could, that probably maybe. Well, very good. All right. Again, all feelings are welcome and are appreciated. All right, Alex, thank you. That looks good. Thanks everybody. All right, we are here with this is the Youth and Young Adults COVID-19 Ambassadors Training. And this is something that Supervisor Chavez and her staff have offered to the community, are these COVID ambassador trainings. And there are general trainings on just to learn more about different aspects and important information to know about COVID-19. First off, it was just about the virus itself, testing, and now vaccinations, so many different things, and this kind of recovery and reopening. But this is a particular training on behavioral health, right? So we are talking, and I appreciated that our oldest could come in and talk a little bit about her experience, and in some ways, some of the things that led up, she had already been in treatment for depression and anxiety, and then it came to a point where it was just overwhelming in a day. And as she said, as Lauren tells folks, and I appreciate the courage and bravery it takes for her to do that, is that she had a particularly bad day and made an attempt, and in 2018, and I think she's done a remarkable job of working on her own mental wellness, and just trying to feel better day in and day out. So as it relates to COVID-19, just know that as a parent of someone who has works on her own depression and anxiety, and just other things, or just being a 19-year-old, COVID was of great concern to us and our family. And so my day job is working in behavioral health at Momentum for Health. We provide mental health services and substance use disorder services to over 4,000, neighbors and folks in the community here in Santa Clara County. But clearly, our family then started consuming services. I had been provider for so many years, and now we're consumers of services as well. So COVID-19, this pandemic, is of particular concern to us, all of us on the panel today, and we look forward to sharing some information, and also want to make sure that we can answer questions that you all have as well today. So before we get into the rest of the deck, actually, I'm sorry, next slide, Alex, we can put up the agenda. So just so you know what our agenda today is, and lots of room for questions and answers, and in both in the chat and if you want to raise your hand, we can do it directly as well. So we're going to talk a little bit about general impacts of COVID-19. I'm going to go through that, protecting behavioral health and wellness in youth and young adults, and the behavioral health supports and services. One thing that we hope absolutely at the end of this you feel is that there is a network, and there are teams out there, both informal, formal, family, and beyond, so that hopefully every young person sort of has team fill in the blank, right? And we want to talk about some of those resources and connections today. So one of the other things I just want to point out, today is May 1st. It is Mental Health Awareness Month, and I just wanted to wear my Mental Health for All shirt. This is our NAMI, the NAMI Santa Clara Walks shirt. This October, we have two important walks. One is the NAMI Walks for mental health, again, mental health for all, usually that theme. And also we have a suicide prevention walk, Santa Clara County South Bay Suicide Prevention Walk. And they're both going to be in October this year. And actually that's where Supervisor Chavez heard Lauren, because they both spoke at the 2019 Suicide Prevention Walk. And so I would just want to point out, those are both important, I think, community events for us locally, that we can shine a light on mental health and suicide prevention, as well as this month of May, Mental Health Awareness Month. Excellent. And so one last thing before we go, before we get into the deck, one of the things I just want to say also today, and I feel like with young folks and all, it's such a great opportunity for us right now to really try to destigmatize and be able to talk more openly and freely about mental health and substance use disorders. And this is a particular concern right now because of what we're going to talk about in a second, about sort of the COVID-19 effect on people's wellness, young folks' wellness. So I feel like I feel like I'm kind of an older older guy, but I feel like I'm kind of cool. But the reason I'm cool, it's not just because I know Supervisor Chavez. It's not just because I know, the county superintendent of County Office of Education. It's not just because I'm Lauren's dad or Matthew's dad. It's not just because I have a, little cute cocker spaniel poodle mix. It's cool because I feel like I'm cool because I care. And I think we're all cool because we care, because that's why we're here today. We care about our community. We care about our families. We care about our friends. We care about our neighbors. We care about people we don't even know, right? And that is really what this training is about. It's about training ourselves, getting up to speed on behavioral health issues, on supports and resources, and extending that information out into the community. So, all right, let's go. Let's do this then. Next slide, please. The impacts of COVID-19 are many. There are so many things that have been exacerbated, that have been exaggerated, that have sort of increased multifold. Lauren talked a little about the isolation and disconnection at the beginning of the pandemic, and as it's, we're getting vaccinated, and the county's done a fantastic job of getting the community vaccinated, really across the state, but really across the country. I think Santa Clara has done a fantastic job. Hopefully some of this isolation and issues are going to abate, right? And yet, I don't know about you, I still feel a little scared still, and I've had both shots since January. So we have these fears and concerns also around finances, job losses, around where we live, our housing security, our own health, uncertainty about schools, our school status, education, and technology needs. Golly, I mean, if my computer and my phone went down, I'm not even sure what I would do. So, having access, having the right equipment. And then again, obviously, how does all this affect your behavioral health? One of the things that we've seen is that in young people, first of all, across all age spans right now, across all ages, behavioral health has become an issue. And as I heard yesterday on a webinar from one of our fellow behavioral health agencies here in the county, Kaminar, they are sponsoring a speaker series, and it kicked off yesterday. It's on their website. I'd go to kaminar.org and check the speaker series out. Dr. Tom Insel used to be the director of the National Institute on Mental Health, NIMH. It is one of the institutes at the National Institute of Health, NIH. And Dr. Insel said that COVID has affected the older population's health greatly. They've borne the brunt of the effects of COVID-19. The behavioral health group that's borne the brunt, he said, have been the young people. And moving forward, that is the concern. And so that is our concern as well. Some of the data that's been coming up that we're most concerned about is across the country, emergency department visits for young people under, I believe it's under 19, has seen a significant increase in folks under 19 going to the emergency department specifically for behavioral health issues. So we can see across different data sets that again, what Dr. Insel said, that the focus for behavioral health concerns and bearing the brunt of the COVID-19 effect really has fallen on young folks, probably under the age of 25. Next slide, please. But as you all know, I'm sure everybody on this call and our friends and family, there are many, many ways that we're learning how to process that stress and emotions in very positive ways. And here are just a few of the ways. Again, I think most importantly, this idea of being around people who are positive, either by phone, Zoom, text, any way of communicating, just staying in contact with people, right? But there are so many ways that we're finding that we are dealing with the stress and all the different emotions that were associated with the pandemic, that we're dealing with it in positive ways. Our work, we started something around mindfulness practice and breathing. Again, there's so many different ways, positive ways that we can actually strengthen ourselves and our own resilience that's in all of us. Some people, their faith has reconnected them to the pandemic's reconnected them to their faith. Their faith is much stronger now, but again, so many different ways. And we want to keep encouraging everyone again in that way of positive, healthy ways of dealing with all this stress. And I would just want to sort of focus also lastly, just on proper eating, getting good sleep, and getting some exercise. That's why, you know, it's no mistake in treatment programs, residential treatment programs and outpatient programs, we stress those things fundamentally. So, okay. So with that, again, it's great to be here with all of you. I think we're cool because we care. And again, I want to thank the great panel, Supervisor Chavez and her staff, and our daughter Lauren for sharing her story, as a little bit of her story as well. Rachel.
Thank you very much. I first wanted to see if there are any questions before we move on to Rachel's presentation, just to see real quick. Rachel, go ahead and pop up. I just wanted to see if there were any questions that folks have, if they wanted to raise their hand, or if we should just keep rolling. I don't see any questions in the Q&A and no raised hands right now. All right, well then we're just gonna keep going. We're gonna go to Rachel, and Rachel, there you go. Make it happen.
All right, wonderful. Thank you, Supervisor Chavez. I'm really happy to be here. I'm just looking at my clock and we are about to approach the afternoon. So good afternoon. And this is actually a great way to spend a Saturday to just be in community. And as we think about being in community, that's part of what supports our behavioral health. And sometimes that's with our family and our friends and our cultural communities that we already know and have access to. But sometimes it's also connecting to resources and supports that we might be revisiting or might be new to us. So I wanted to share some of the local County of Santa Clara resources related to behavioral health supports and services. These might be for yourself, a family member, or a friend that might benefit from behavioral health support. And as we get started, just with kind of looking at this resource list, I think like when we think about feeling sad or anxious, which sometimes might be called anxiety or depression, or we're feeling stress related to a variety of events, including the pandemic, that behavioral health and behavioral wellness is really on a spectrum. So there's days where we all might feel a little bit of sadness. There's days where we all might feel a little bit of anxiety. We make some connections, we get a good night's sleep. The next day it might dissipate a little bit. And then there's times where we might find that it's more persistent or ongoing, and we might have a day where just out of the blue, we feel so stressed and overwhelmed, and we're really wondering how to cope. So our network of support is really meant to think about the spectrum of behavioral health needs. And so as we go through these resources, we can kind of hold those in mind. So the first set of resources I'll talk about is our crisis support services. And so the Behavioral Health Services Department Suicide and Crisis line, you'll see the number there, 855-278-4204. That's a confidential suicide prevention hotline. We have over 70 trained volunteers who are crisis phone counselors. This line is staffed 24 hours a day, 7 days a week, and phone intervention is provided related to emotional support for individuals that might be experiencing different forms of crisis, emotional or situational distress, a need for ongoing support, as well as information and referral. And kind of parallel to that is a service that was introduced recently in the last couple of years is a text crisis support line. And so to access the text support, you can just text in the word renew to the number 741741. And the vast majority of the crisis text line users are young people under the age of 25. Many people text to get support related to suicidal thoughts, but also for support related to intense emotions, but also for information regarding behavioral health resources. We also have our mobile crisis response team, which you'll sometimes hear the acronym MCRT. And the mobile crisis response team provides immediate responses and delivers crisis intervention services throughout the county. Callers are screened and assessed first by phone, and then if needed, and if the individual is wanting that support in person, then we have clinicians who can respond in person to provide crisis screening, intervention, de-escalation support, and connection to community resources. And our county has a specialized mobile response team for children and youth. And so I'll actually talk about that in just a moment. For other behavioral health supports that might not be kind of immediate, I need help today, right now, in this moment. We have a couple of options. The first is the Behavioral Health Services Department call center, and that's a centralized entry point for individuals seeking behavioral health services. Clinicians and other staff are available by phone to provide screening and referral to behavioral health programs and resources. And I'll cover many of those programs and resources a little bit later in our webinar today. The Gateway Call Center for Substance Use and Treatment Services is a central point of entry for alcohol and drug services for youth and for adults. They provide information, referrals, and screening. And screeners talk with callers to match the individual to the program that would be most beneficial for them. And as part of the Gateway Call Center, we have a special line for youth to call. And youth can call directly to receive information, referrals, and screening Monday through Friday from 9 to 6. And the referral coordinator is trained to talk with young people and answer their questions. Substance use services for youth 12 and older are generally confidential. And so that number is 408-272-6518. And during the evenings and weekends, the regular Gateway number can be called. And so that number is 800-488-9919. So these are a number of different resources and phone numbers. In the future, we are anticipating that we'll have one phone number so that our community members, our young people, parents, adults will have one number to call, and then we'll be able to get you to the right place. But for right now, there's a couple of different phone numbers to call. But if you call one, they'll make sure you get connected to the right place. So really all of these numbers are a resource to you, your friends, your family, and the community. In addition, there's the County of Santa Clara Facebook Live. So the Santa Clara County Public Health Department has hosted a number of Facebook Live sessions that have all been recorded. And later on in the presentation, I'll highlight a couple of those recordings that are really geared towards behavioral health, but also some of the sessions have been geared towards youth mental health as well. And then the National Child Traumatic Stress Network is a wonderful resource that focuses on the health and wellness and healing of children and of young people and young adults. And they have information that's specific to trauma, such as community violence, abuse and neglect, but also natural disasters. And they have a whole section dedicated to resources related to the COVID-19 pandemic. So that's also a resource to you. Next slide, please. Thank you. So our mobile crisis for children and youth is operated by Uplift Family Services. And this is a number that parents can call to get support for their children, and youth can call this number directly. Typical crises might include suicidal thoughts, intense anxiety and fear that might feel overwhelming and is creating a sense of distress and feeling unable to maybe manage, as well as just kind of behavioral support when somebody is feeling like they need immediate behavioral health assistance. So young people or parents can call this line, and a clinician will provide immediate support by phone. And then we'll respond in person if that's needed and desired to de-escalate the situation, to provide support, to stabilize what's happening in the moment, and to help that young person back into a feeling of calm and control. And then resources and referrals for ongoing support are also provided. So I think we're handing it off to our next presenter.
Thank you. And if there are, I'm not seeing any, for all the resources that are here, I just want to remind folks, we'll get those all to you, that what you're getting to learn. And I want to turn it over to Dr. Dewan.
Great. Thank you so much, Supervisor Chavez, for having us today and for your leadership and support in recognizing how important our youth and youth voice is to our community. Thank you also, David, Minetta, Lauren, for sharing your stories, and also to Rachel for sharing the resources so far. We're going to start this section with a Minty Poll. And our question that we're going to ask all of you today is, have you sought out behavioral health services for yourself or someone else? So we're going to invite you to join us again at minty.com. And we'll give you the code. It's 2701-4994. And we know that the pandemic has had a significant impact on everyone. We acknowledge there's been a lot of anxiety and maybe sometimes feeling isolated, perhaps loss, and other kinds of feelings that we've all had because maybe there are things we didn't know or we worried about in the future. So just let us know if you sought out behavioral health services for yourself or maybe for someone else, a family member or a friend. So yes for myself, yes for others, yes for myself and others, or no. We have a new number for the Minty.com. The number is 9864-5502. 9864-5502 at Minty.com. Let's take a few more seconds here to give you all an opportunity to respond. So I see that some of us here in the group have sought out behavioral health services for ourselves or maybe for ourselves and others. And some of us may not have found ourselves in a situation or experiencing feelings that caused us to consider it. We also recognize that many young people might engage with others at their school or in their school campus and find that they get the support that they need there with their peers. Alex, we'll go ahead and close out the Minty poll and go back to the slide deck. Earlier, we heard David share about some of the ways to process stress and emotions in positive ways. And one of those was to focus on the future and what you're looking forward to. As I mentioned earlier, we know more than we did in March 2020 about COVID-19. And so we have a lot of opportunity now to turn our attention to the future and what we're looking forward to. And one of the things that we know is that vaccines are available for our 16 and 17-year-olds, and really anyone over 16 or older. And we know that having a vaccine will allow a safer operation of our schools and make the end of the school year and our summer activities a lot safer for all of us. It's not just for you, it's also for the community and for your family and friends. The more of us who are vaccinated, the better chance we have to knock out COVID-19 and to return to as many of the activities we love and are looking forward to. So anyone over the age of 16 is eligible. We know that there may be some anxiety around getting the vaccine, but the vaccine is safe. It is something that you do need your parents' permission if you are 16 or 17 years old. And there are many ways that you can secure your parents' permission. They can sign the consent form. A parent or guardian can come with you to one of our vaccination sites, or if your parent or guardian is available by phone when you're at the vaccination site, then we can also get the parents' permission so you can get your vaccine. It is your turn, and we're very excited to offer COVID-19 vaccines to our 16 and 17-year-olds. Today we have an event at James Lick High School that goes till 5 o'clock. And we'll be announcing soon some very special events at Levi Stadium. So we'll also encourage all of you to please share about the vaccines, because we think this is one of the ways that we can reduce our anxiety and fear and really help all of us look to the future. Next slide. One of the things we've been asked a lot about in the last year is just where can I get information? Where can I find some resources? And we wanted to share with all of you today that on our website, the Stronger Together learning resources are available. And there's information there for students, for parents, for teachers, and also for leaders in our schools. Next slide. So we know a lot more than we did before, and really returning to school and to in-person instruction is safe, and it's something we're encouraging everyone to consider as our schools are reopening. Maybe we're afraid of getting COVID-19, and what we've learned is that if for young people who have contracted COVID-19, they're much more likely to have gotten COVID-19 at a large gathering or mixing with other groups or going to parties, and very unlikely to contract COVID-19 in schools or in childcare and in person. And we know a lot of young people are really looking forward to returning to school campuses and seeing their friends and benefiting from in-person instruction. Next slide. One of the things that we've been hearing from young people too is that they're trying to find different ways to cope with the anxiety and maybe the isolation. And we've seen some increases in the use of vaping during COVID-19. We really think it's important for young people to understand how dangerous vaping is. It's always dangerous, but it's even more of a concern when we consider vaping and COVID-19. So if we want to help protect our young people and your health, we really encourage you to avoid vaping. And if you have friends and peers who are also vaping or smoking, using tobacco, this is a great time to consider cessation, quit smoking and quit vaping. And there's information available to help. Sometimes it's hard to stop a new habit, and vaping and smoking can be quite addictive. So there are some resources available at the helpline, the 1-844-8-NO-VAPE. And you can also text at quit smoking or quit vaping to 66819 to get resources and information. Next slide, please. Our office also operates the Tobacco Use Prevention Education Program. And what this program addresses is really resources for youth. And we have peer advocates, young people who know a lot about tobacco use prevention and vaping prevention, and also cessation activities. And there are a bunch of resources available in your community that you can find on our website as well. So other behavioral health partners and community groups, community-based organizations that are really designed to support young people. So I encourage you to visit that site if this is an area of interest for you, or you know someone who is vaping or smoking, or you yourself might want these resources. Next slide. So I mentioned the cessation resource, and I just want to share that all of the services are free, and the counselors are available many of the hours. So you can sign up online 24/7, but the counselors are available by phone 7 a.m. to 9 p.m. and on Saturdays from 9 to 5. Next slide. And just one more plug for the vape cessation activities. The phone numbers are listed here. And we also wanted to make sure that all of our young people know that these are available in multiple languages. So you can also call and speak to a counselor in Chinese, Korean, Spanish, and Vietnamese. Next slide. During the COVID-19 pandemic, many of our school health clinics were closed, and many of you may have been used to visiting a school health clinic. Want to share that the school health clinics are open and that many of them also have behavioral health services and resources available. So this is the list of the clinics that are available in many of our communities here in San Jose, also in Gilroy. And you can find the phone numbers and the addresses listed here on the slide. Next slide. The mental health resources, we're really talking about mental health and wellness and equating our emotional and our social and behavioral health to be as important, if not more important, than our physical health. The Department of Health and Human Services has information available that is just specialty care for children and youth. And the phone number is listed here on the slide at 1-800-704-0900. And we also know that a lot of young people are experiencing things, and it really helps to understand each other and to hear from each other. And there's a really special program, the California's Mental Health Movement Resource Center and the Walk in Our Shoes program. And these are active links on this slide that we'll be sending out after today's event. Next slide. For young people experiencing crises, there are phone numbers available. Again, you can utilize the 24-hour suicide prevention lifeline. And this phone number is available during COVID-19 with expanded hours and expanded resources, but the number is always available as well. And it's 1-800-273-8255, or you can text to 838-255. And there is also a parent and youth helpline, which you can call, text, or live chat, and that is at 855-427-2736. And this number is really best for those things that are not crisis situations, just maybe information you'd like to have about COVID, information about health and wellness resources. Next slide. So we wanted to share some information that perhaps you might want to offer to parents or family members or neighbors. We know that sometimes young people can really be great advocates for helping others reach out and get support that they might need. So we're sharing today the Warm Line. The Warm Line is a free phone number, and we also have an email address that parents and educators and others can call to get individualized supports and ideas for helping young children, perhaps children with disabilities or children who are having behavioral health needs. And so maybe the parents just need some ideas to help manage the behavior that they're seeing. And this is especially true for maybe our young siblings who are 2 and 3 years old or older, maybe into the elementary grades. And so again, we just want to encourage you all to share this information out as you see that it's appropriate. And we have the warm line available in English, Spanish, Vietnamese, as well as other languages. So a great resource for our families. Next slide. Some of the information available at the warm line includes resources, access to screenings, developmental screenings, so to help families know if their children are on track with their development, and also to get information about COVID-19 and access to digital resources. Maybe they need assistance with the internet connectivity or other devices. Next slide. Some of you might be also hearing from your family members. You might have younger siblings or cousins, neighbors who are wondering about when they can go back to childcare or when they should be enrolling back in school for their transitional kindergarten 4-year-olds or 5-year-olds. So we want to share with all of you that it is time. Childcare is open. It is time to enroll, and so you can share this enrollsantaclara.org website with your families and friends to help get all of our siblings and cousins enrolled in school and to find childcare. Next slide. And then lastly, we wanted to share about our Impact Weekly newsletter. And on this newsletter, we share information about all kinds of activities for young people, also for adults and educators. You can sign up and receive this weekly newsletter. We've been sharing out about vaccine events, about Youth Voice Live, and many ways in which young people can participate in our county. And also resources are provided in the Impact Weekly. So hope that, that you all consider signing up. Back to you, Supervisor Chavez.
Great, thank you so much. And thanks for all that great information. And I see that we've had most of our questions are being answered. But let me see, are there any questions that folks have that have joined us? And you can feel free to raise your hand. And Dr. Dewan, I think this might be for you. And this is a question that says, what about the new Youth Advisory Committee?
That's a really wonderful question. We have a new Youth Advisory Committee that is a countywide committee made up of young people. We had 80 young people apply to be a part of the committee, and all have been interviewed, and they'll be receiving information about their opportunities for participation. And we also want to share that it's really a way for youth to share with us what they need in their school campuses and what they would like to see in terms of wellness activities and peer supports and ways for them to be engaged.
That's excellent. And are there any other questions? You can feel free to raise your hand, or you can put them in the Q&A or in the chat.
Cindy, I was just thinking, you know, one of the things that I failed to mention earlier was that the federal government has been looking at, you know, doing studies, trying to figure out who's has been affected most with, you know, in the pandemic. I mean, whose behavioral health, mental wellness has been affected, and you know, a lot of different groups. But I think some groups, just to sort of note and call out, one have been young folks, right, young people. Two have been caregivers for you know, just caregivers for people providing help in home. But the other have been communities of color. So I think all ages and, you know, Black and Indigenous groups and other communities of color, other people of color. So it is something that, you know, we've been trying to pay particular attention to here in Santa Clara County, and also want to make sure that resources are again put out into the community that are, you know, diverse and multilingual, as Dr. Dewan pointed out, and multicultural. So.
Yeah, that's great feedback, David. And I think too, just to, add a point to that, one of the thoughts I would just share is that if any of you have requests for us about, doing any kind of communication or training in specific languages, please let us know, because we're really excited to do that. And even if, as a young person, you want us to put some slides together for you to be able to share, we would be more than happy to do that. Alex in our office will put our email in the chat, and so if you are interested in that, let us know. Now you'll get all of these slides, so you could do that on your own too, but if we can be of any assistance to you, please let us know. So that's a really good point. Other thoughts or questions, or even you guys, if you have ideas, I know that listening helps people suffering from mental health issues. So what are some other ways to help support someone more directly? And I know we have some doctors on the line as well. So I don't know, David, if you'd like to respond to that, or if we should have one of our doctors that's here.
Yeah, I mean, if I could also, and then give way for the doctors as well. One other just of note, when we talk about behavioral health, we are talking about both, again, mental health conditions as well as substance use disorders. And for young people, sometimes there can be a tendency also to self-medicate when there are sort of emerging mental health conditions. So that was the other area that just the information that Rachel presented. Also, those numbers for the substance disorder side, and then folks who have sort of both sort of co-occurring issues, are very important for us to sort of pay attention to and to be mindful of. I know that sometimes the substance use disorder side of the behavioral health world is even more stigmatized than the mental health conditions. I've worked with families before. A mother told me, I'd rather my kid be a criminal than be a drug addict. Her kid was only 15 years old. It's just something that I think that we just have to be mindful of in these really stressful sort of pandemic, race equity. Last year, I think, with the pandemic, the fires, all the racial equity issues after George Floyd, and then we had an election. That was a lot of stress last year in 20, and a lot of it's followed us into 21 with the drought, and now, so anyway, yeah.
Dr. Dewan, do you want to send that question to a particular person on your team, or would you like me to do that? Or go ahead, Dr. Dewan, if you want to ask.
So I think we could ask to see if Corinne would like to respond.
Corinne, you're on mute. Yeah, there you go.
Got that. Responding to the youth advisory group specifically?
No, this was, what else can we offer to someone besides being a good listening ear?
I see. Okay, so I think in my head, because yesterday we just met with the youth advisory group, and so they actually had phenomenal ideas about how to respond from their lens. And so from their lens, a lot of the things they said was to find something that brings you that kind of ability to relax in your anxiety. Or some people said if they had a dog, honestly, if they had something that breathing techniques, they talked about reaching out to friends. So there were a lot of things that they came up with that were at their kind of core of what would help them if they were feeling in that space. And I thought that that was very important because of what they're dealing with within each other. What they're dealing with right now that we may not be dealing with as adults. And so they really talked a lot about reaching out to one another and just that feeling of connectedness, that there was no isolation. That was something that they talked a lot about, and they found that in different ways. And so we thought that was very poignant for them to talk about with each other as well. And they're going to then be sharing that out as the youth advisory group.
Great. And any other offers of ideas?
We would also just encourage that, in addition to listening, encouraging them to consider calling and reaching out for other resources, as well as if you feel unsafe or you feel that your friend is unsafe, to reach out to a trusted adult and get additional support.
That's great. So one thing, there was a question here that are all of the locations walk up or appointments required? And what I would say is that I think that Dr. Juwan, I think Gilroy is walk up. But what I would say is you guys go to any of these locations. People are not going to turn you away. So don't, you can go online to sccfreevax.org and we'll put that in the chat, sccfreevax.org, and it'll tell you that the times that all these different facilities are open. And we have a number of them open tomorrow. And at James Lick today, for everybody who goes and gets vaccinated, they're getting a free boba drink. So we're really, and partly because you young folks told us to have food and treats. So there you go. We are listening to you. And we are really looking to get everybody vaccinated. So please come. And I don't know, Dr. Juwan, if you want to add anything to that.
Yes, so you can make appointments, but we have plenty of vaccine, and so we really encourage young people to come even without an appointment. And we also encourage you to please bring a friend, a family member, a neighbor, bring someone with you to the vaccine site who has not yet been vaccinated.
Yes, we want your whole family, everybody. And if you go on sccfreevax.org, what you're also going to see is a whole number of locations. They're all over the place. So we will get you vaccinated. Alex is just letting folks know if they want to be anonymous that there's a way to do that. They can ask questions through the Q&A feature anonymously. But I just want to make sure, is there anyone else that has a thought or a comment or a question? You can raise your hand or chat or put it in the Q&A. No. Well, two things I wanted to just say is that we recorded today, so we'll send you the recording out. So if you want to share it with anybody who may have questions about, oh, I'm sorry, Rachel's going to present. I'm sorry. Rachel, you're going to present on another topic?
I am. I'm continuing
Okay,
to
go
talk a
ahead,
little
go
bit
ahead.
about some of the behavioral health resources.
Great, thank you.
Thank you, Supervisor Chavez. I think as we think about the question actually that was just asked about, listening is so important, but in addition to that, there are many other things that that you can do as a friend, as a family member, and also what we can do as a community. And I think some of the things we can do are actually embedded in the vision and mission of our Behavioral Health Services Department, and ensuring that we're supporting people in having the opportunity to be both physically and emotionally happy and thriving, how we can support a sense of safety, support connections so that individuals are part of a loving and supportive social network. And that's been harder during this past year with the pandemic. And so that's really quite essential. Listening, feeling part of a community, being involved in meaningful activities such as school, work, hobbies, other activities, and that we all are safe from harm from the environment or others. And our mission at Behavioral Health Services Department is to assist individuals in our community affected by mental health, mental illness, and serious emotional disturbance so that people can achieve their hopes and dreams and quality of life goals. And that when we think about the services and supports that we offer, that we really are customizing our services and supports to the needs of children, of youth, of family and adults in ways that are non-stigmatizing, accessible, coordinated, and are respectful to a person's family and loved ones' language, culture, ethnicity, gender, and sexual identity. Next slide, please. There's a number of programs that we have available to support young people in Santa Clara County. All of these programs and services, I won't go through each one, but if you have questions about them that are not answered today or come up for you at a later time, you can call our behavioral health call center and they can answer and help get you or others directed to the right place. And so that number I'll mention again, but it was on the previous slide. It's 1-800-704-0900. Many of our services are for Medi-Cal insurance beneficiaries, but some of our services are open to all of our community members, regardless of insurance. Our children, youth, and then TAY stands for Transitional Age Youth, which is youth up to the age of 24. And Family System has a number of services and supports that are provided by the County Behavioral Health Services Department, but also by many of our contracted community providers. Momentum, which David is a part of, is actually one of those. Our services are organized by the intensity of need and looking at developmental and chronological age and specific needs related to youth that might be involved with our child welfare system or our juvenile justice system. And services are provided in a number of languages, and we have an array of providers, peer support workers, community workers, counselors, as well as licensed social workers, marriage family therapists, and psychologists. And we also have medical support through psychiatrists and other physician specialties for medication evaluation and support. Examples of things that are offered as part of services are assessment, individual, group, and family therapy, care coordination, meaning connecting, making sure that anybody that's supporting you in a professional way, as well as your natural supports, are all working together on your behalf, your team, if you will. As well as making sure that in the assessment process, we really have the opportunity to hear about your needs, what you're wanting to gain from behavioral health support, so that we're focusing in on the individual and the family, and we're collaborating in a way that really focuses on the individual needs around healing. So anxiety and depression, developmental concerns, trauma are very typical reasons why somebody might utilize behavioral health services, but also sometimes more serious needs such as schizophrenia or paranoia. So the first box on the left-hand side lists our prevention and early intervention programs. And these services might be at schools or home or the community or in a clinic. And the focus is really preventing long-term behavioral health needs. And it's one of the most important areas on our continuum because intervening early has proven impact on the prevention of longer-term behavioral health needs. And so we have programs such as our schooling services and prevention and early intervention, which are provided at schools throughout Santa Clara County, where we have clinicians on school campuses reaching out and supporting students and families. Another example of a program is the REACH program, Raising Early Awareness and Creating Hope. And this program focuses on the early identification of psychosis. The next box is our outpatient programs. And so these are programs that might be clinic-based, meaning individuals might come to a clinic. Right now, we're doing a lot of telehealth, but also we have services and supports that might be at schools or other places in the community. And we also have programs where we can come to somebody's home and provide support for individuals in their homes. And now that vaccinations are more widely available, we're able to now expand some of our home-based services that had been paused for a period of time because of the pandemic. So we have ethnic-specific outpatient services. Our Kid Connections Network is a specialized program around the special needs of children birth to 5. And then we have programs that are focusing on transition age youth, as well as our young adult transition team for young people. Our more intensive programs usually are when individuals might benefit from services and support 2 to 3 times a week. And so we have a variety of programs that focus on kind of the general needs, but also specific to young people that might be involved with the child welfare system, where there have been concerns about abuse or neglect, as well as our juvenile justice system. And then we have intensive services as well as residential programs when there are more intensive needs and supports that would be beneficial. And then at the bottom of the slide, you can see crisis services, which I mentioned previously, can be accessed across this continuum of care. Next slide, please. Next slide, please. Thank you. So we have a new program that was developed during the pandemic. This program is called Virtual You, Navigating Wellness Online. And this was specifically developed to support young people between the ages of 12 and 25 as a virtual wellness center providing engagement, education, and wellness activities. Some of the activities include mindfulness groups, game nights, youth technology programs, art expression, virtual yoga. And these activities can be accessed by emailing or calling this phone number, 408-961-4700. There's also a video about the Virtual You, and I'll drop this link into the chat for you shortly so that you can easily be able to copy and paste it. And I'll also do that with the email address. Coming soon, we have 2 youth integrated health centers known as Alcove. These will be opening in the near future. One center will be in San Jose and one center will be in Palo Alto. And these centers aim to empower peers and young people. And the development of these centers have been with the input and voice of young people through the Youth Advisory Group, which is known as YAG, as an acronym, YAG, Youth Advisory Group. These are young people who are involved in the planning and implementation and evaluation of the services and programs, including the site identification, the design, the development of the marketing, as well as outreach. All of the Alcove sites will be youth-friendly, culturally and linguistically responsive, accessible to youth. And the Youth Advisory Group is providing and will continue to provide input and guidance. They've been doing this from the project beginning, from the ground up, and will continue to do so as the centers open. And it's with input of the community youth from the initiation of the project that's really allowed the development of services to be tailored in a way that best meets the needs of youth in the community that the centers will serve. Next slide, please. So we've been changing the way that we work in behavioral health over the past year. Telehealth has been very common in our use of providing support to people in our community. And we have been using hybrid models where we've been both providing telehealth support, but also in-person support when it's been safe and appropriate to do so. And many of our sessions have actually been outside. And so it's not been uncommon when we do need to meet with young people and others in the community that will hold sessions outside, kind of have a walk and talk sometimes. We've also created therapeutic care packages that contain markers or kind of colored pencils, cards, stress balls, journals that can be used as part of the telehealth sessions, but also can be utilized to support expression of one's feelings and experiences outside of sessions. And some of the things that we can do to support, I think the question earlier around how do we support other people other than listening, instilling a sense of hope, connecting to natural support systems, routine and structure are really important and they give us a sense of familiarity. Spending time with family and friends in ways that keep people safe. Learning about mental health. The internet can be a good thing in many ways around this, but also making sure that that information is coming from a reliable source that's giving appropriate information that's helpful. Writing in a journal, focusing on slowing down your breathing and trying to be in the present moment while paying attention to your thoughts, as well as meditation or visualization or relaxation exercises. So those are some of the things that have been very helpful to people, particularly in this past year. And then the final resource that I wanted to share with you, I mentioned earlier, is a list of Facebook Live recordings. So these are available on Facebook, and there's some particular recordings that were designed specifically for children and youth. So the May 11th recording is in general, how to protect your behavioral health, your mental health during COVID-19. But on June 11th, there's a recording that you could listen to that's specifically about summer activities. And here we are approaching summer. So that might be of usefulness. And these are safe summer activities that you can do in ways that maintain social distancing and abide by our protocols. On June 24th, there was a recording around the emotional needs and risks for young children and teens during shelter in place. And then on August 10th, helping our youth and young adults cope with COVID-19. Each of these Facebook recordings is just about 10 minutes long, maybe 12 or 13 for a couple of them. So they're just kind of quick little recordings that are informational and hopefully helpful to you and your friends and family members. So I think that's my last slide.
Thank you so much. Really appreciate it. And what I'm going to do is I want to ask if we could see if there are any questions. First, let me start with any questions for Rachel. And I want to thank you, Dr. Juan, for weighing in there. So what we'll make sure of is that everybody has access to all of the slides from today. You'll get an email afterwards, and we'll also make sure that we post this so that folks can listen to it at a later time. And we're going to close us out, I want to thank really Dr. Dewan, David Mineta, Rachel Talamantes, and also Lauren, who got us started today, and all the doctors who joined us and the staff from Dr. Dewan's team. They're just amazing, and to my own team, a big thank you. But I thought we should end with our last Minty Poll. How does that sound? And Alex, can I ask you to put it up? All right. So how hopeful are you feeling today about the recovery of COVID-19? And the number is 2701-4994. 2701-4994. This will be our last Minty for the day. See if folks want to weigh in there. So we have some not very hopeful, somewhat hopeful, very hopeful. Just keep weighing in. You want to see how you're doing. Well, yep, I think we're good. Well, let me just say the very hopeful, somewhat hopeful, not very hopeful, however you're feeling today, it's absolutely, of course, okay to feel that way. And really what you've given us a reminder of is that we have much to do, and we will continue to do it to get us all across the finish line, and recognize that, you know, this is an opportunity for us really to share information with our friends and neighbors, and maybe information that they didn't even know they needed. And maybe they needed it before COVID-19, and now it's okay to ask for help. So I'm going to ask Alex to stop sharing his screen and show all these beautiful faces, so I can say one last very sincere thank you for all of you spending Saturday with us. And to all of the young folks who joined us today, thank you for taking leadership in our community to take care of others. And please get this this video out to your friends and family, as we think it will be helpful to connecting people with services. Dr. Dewan, do you want to say anything, or Dr. Mineta? There you go. I made you a doctor.
Yeah, just thank you so much to all of the youth for being here with us today. And we just so honor all of you for what you've had to experience during COVID-19, and really excited to see you out back in person and hopefully at a vaccine clinic. Also, just really thank you, Supervisor Chavez, and your team for your leadership and keeping us safe as an entire county during the pandemic. I can't imagine where we would have been without your leadership. And lastly, to all the young people, we gave out a lot of phone numbers today. Don't worry. If you call any one of the numbers, we will make sure to get you where you need to be.
Perfect, David.
Yeah, thank you. Thanks for the promotion, Cindy. I appreciate getting the title. I always, thank you. So, big thank you to Supervisor Chavez and her staff. I can't tell you everybody how hard they've been working through the pandemic. Before the pandemic on our behalf, but during the pandemic, 24/7, 365. So thank you all. This is, such critical information to get out to everybody. Dr. Dewan and the Santa Clara County Office of Ed staff, again, just holding it up for thousands and thousands of kids across the county. And Rachel and all the folks from the behavioral health department, man, just awesome, and great information, Rachel, today. That was excellent, with Dr. Dewan's all of her information. So lastly, to Lauren and to the other young folks, I appreciate Lauren coming out and saying yes to Supervisor Chavez, Dr. Chavez. I'll promote a title for her as well. But for the young people, again, this is obviously this is historic, unprecedented, but this is going to follow us for possibly, years, right? So this information that you got today that you can collect on your own is going to be so important from not just today forward, but for today forward for years. So it is hopefully, we can build this big, larger community of folks that know about behavioral health that will destigmatize and help folks get to services that they need. No one should suffer on their own on this. So again, thank you to all. And, I'm cool because I care. I think we're all cool because we care. So thank you.
And for you young folks that are participating, you have to let us know if we can say we're cool still. I will just say again, I deeply appreciate all of you, and David, thank you for being our inspiration on all the mental health work, and Rachel, to you and your team, you have been relentless, and to the County Office of Education, where would we be without you, and to all these young people, thank you. Take care of each other, take care of yourselves, and remember, get vaccinated. Make your families get vaccinated. We have vaccine, come and get it. So everybody have a really safe, blessed day. Thanks all. Be well. Thank you.
Thank you, everybody. This was great.
Thank you.
Thank you, everyone.
Thank you.
Thank you.